Time now for our Ask the Doctor segment. You can call our phone lines right now at 334-420-9732 to get your medical questions answered by Dr. Brian Sellers. Dr. Sellers is joining us live now over Zoom. And Dr. Sellers, or by phone, Dr. Sellers, remind us what you do, what kind of doctor you are, what all do you do at your office?
Sure, thank you. I'm a vascular surgeon, so we treat disorders of the arteries, the veins, and lymphatic vessels everywhere except the brain and the heart. So we do plaque buildup in the arteries of the legs, which is peripheral arterial disease. We do blockages in the carotid arteries, which can put you at risk for stroke. We take care of aortic aneurysms. We take care of varicose veins, and dialysis access is the main part of our practice.
How do you know if this is an issue? Let's say you don't really have a genetic history that you know of. How do you know it's time to see a vascular surgeon or a vascular specialist?
Sure. So that can be a challenging question. A lot of our patients are a little bit older. So as part of the aging process, we do tend to develop plaque buildup in the arteries. Certain risk factors like genetics, age, family history. If you had a parent or a grandparent or brother or sister who had plaque buildup, you'll be at higher risk. But also things like high cholesterol, diabetes, tobacco use. Those things can also put you at higher risk. Some of the things that we run into, though, would be generic things like leg fatigue, weakness, pain, cramping when you walk. It's not uncommon for people to come in and think they're just getting older, and they just think that this is part of the normal aging process, which it may not be. So really, what I encourage people to do is, if there's anything different about your health or anything that you're having trouble with, please see a doctor and let them check you out and make sure it's not something more serious.
And we have a caller on the line, Star from Montgomery. Star, what's your question?
My question is regarding Raynaud's syndrome. Is
Sure.
there any effective treatment for that available?
Well, there's not a surgery that's going to correct it. So when it comes to treatment of Raynaud's, for the people that don't know what Raynaud's is a vasospasm that occurs typically in the hands. People are genetically predisposed to it. Exposure to cold tends to bring it on. And most often the hands will turn colors. They'll turn blue, pale, and then white. And when you remove the symptoms, they usually get better. So for you specifically, there's not a cure per se. The treatment really is to avoid those exposures to cold. There are some medications that will help, usually blood pressure medications. Calcium channel blockers is the class of drugs that usually works the best, and that helps relax the muscles in the artery walls and improve the perfusion of the hand. There have been sometimes we send people for interventional radiology procedures that may help short term, but long term is really more supportive care and taking those medications.
Okay, thank you.
Yes, ma'am.
We have another caller on the line, Gina from Eufaula. Gina, what's your question?
I have from time to time swelling of my ankles, and I was just wondering what causes that.
There are a lot of things that can cause swelling in the ankles. From a medical standpoint, it's a good place to start as your primary care physician. It can be medication related. It can be related to dysfunction of the heart, the liver, the kidneys. Even nutrition can play a role in it. So there are a lot of things that can make your ankles swell. From a vascular surgical standpoint, the thing we deal with most often is going to be either varicose veins or what we call lymphedema. So those are things that can easily be worked up in the office and evaluated, but a good place to start is with your primary care doctor.
Thank you.
Man.
All right, Gina, thanks so much for calling. After the break, we're going to continue our Ask the Doctor segment. If you have a question, now is your time to call. That number is 334-420-9732. We'll be right back after this break.